See, we're asking one question that's stimulating people to think of other ones.
No, I actually came for this question. I just wanted others to have a chance first to speak. When there's a situation where a parent is in a skilled nursing facility and a medical director is also the attending physician, it's a small facility, and the family disagrees with the doctor taking the resident, the parent, off of a medication and putting him on something else, who wins that battle between the family and the medical director?
Well, so the question really actually may not, neither one of them may win that depending on the circumstances. So the parent is in a nursing facility. There is a medication being used. And just for the sake of discussion, let's use one that has no real proven benefit in some circumstances. So in Alzheimer's disease, you may have a medication that is being used to help the Alzheimer's disease, and we can pick common ones, the donepezil, Aricept, or memantine, the Nemendas, things like that. If you have somebody who's been on one of those medications for a long period of time, that discussion may arise, and the distinction there is, in that circumstance, the parent is cognitively impaired and can't participate in the decision-making process. That is a little different than if you picked maybe an antihypertensive drug and the parent does have the ability to participate in that process. So if you have the easier scenario, which is the parent is cognitively intact, doesn't matter what the family wants done, doesn't matter what the medical director wants done, if that resident says, I don't want to take this medication, they're not taking it. End of discussion. Doesn't matter what I think is best for them as a medical director and the attending. If the patient says, I don't want to take that medication and they're cognitively intact, there is nothing I do other than not give them the medication in that circumstance. If the patient is not cognitively intact and the medication is a medication that the family wants to use and it is of no clearly documented benefit. So I have a medication that is approved by the FDA for something. It was being given for something else. No clear evidence, doesn't have an indication for that purpose, no clear evidence that it's being of benefit, and the attending physician says, I'm not going to prescribe that medication any longer, there's no benefit to it. The family may want to have that medication prescribed. Their obligation will become finding a physician who feels that that's medically reasonable to do and will write for that prescription, and then the family, who has responsibility of guardianship in this circumstance, will then have to turn over care to another clinician. There are some circumstances where that actually may not work either. If this is a medication that is likely to harm the individual and you can't find a physician who's willing to do that, there is not an obligation to do harm. In fact, there is an obligation not to do harm. And it is likely that in that circumstance it will go before the ethics committee, and if you want that medication given in that particular facility, you may actually have to take that resident out of the facility and try to find somebody who will provide that medication. If, see, I'm going to give you all the scenarios that I can, probably won't be all of them. If I finish, there'll probably still be a few more. But if you have a circumstance where it is a little bit debatable, and that's the circumstance that I had earlier, where you're giving somebody with Alzheimer's disease, say you're giving them memantine or Namenda. If you're giving that particular drug and the family says, I think this is helping mom, when we stop giving that, she changes. And the physician says, I don't really see any change, we've done some formal testing, there's nothing that we can really demonstrate, and you say, I know that the tests don't show it, but I can tell she's different, and I would like her to continue to get that agent. Then you have a real challenge, because the drug is approved for that disease process. It is an expensive drug. You would like to have it be useful. If the attending physician doesn't want to give it, sometimes your recourse is to go to the medical director, But in this circumstance, the medical director is the attending physician. And so you may say, I really think this person needs it. The attending physician, the medical director in this circumstance says, I think this potentially is harmful, could increase fall risk, I don't see any benefit, I'm not going to continue to prescribe it. Your option then is to say, okay, I would like a different physician and try to identify a different physician who would be willing to prescribe it. As the medical director, if the medical director intervenes and says, I think this is causing harm to this patient, you will probably end up putting an ethics committee together to determine whether or not that patient can stay in the facility and get this medication. And that will probably involve also bringing in an outside physician as part of the team that evaluates this. That is a long, drawn-out process, and you may end up finding that it's easier and better to go to a different facility. It's an option that's available to you, but there are lots of options. And the last thing is, you have an ombudsman in the nursing home. Every nursing home, every resident in a nursing home has an ombudsman. And you can always go to the ombudsman and say, this is the scenario, I think this person should get it. And then the ombudsman can then actually take it to most states have a medical director that oversees the regulatory issues for long-term care, and it actually can go back to the state. So there are lots of options in that circumstance. Obviously, we always like to get everybody together talking on the same plane and hopefully having everybody agree, but as much as you would like that, in every circumstance, that doesn't occur.
The ombudsman could go to the assisted living facility too?
I think so, yeah.
There is an ombudsman for assisted living. I'm not sure the role, though, in terms of the oversight for the assisted living versus the nursing home. I'm sure the circumstance with the nursing home, the ombudsman role in the assisted living, I'm not sure about that.